Assalamu alaikum wa rahmatullahi wa barakatuh, both sisters. Welcome to this another edition of our Women's Faith and Health every Tuesday at 11 a.m. during this Ramadan. I am Sharifat Muhammad Kamal. You are listening to Radio Ramadan 87.9 FM online at radioramadan.org. You can text, message, or WhatsApp us on 077-614-64614 for your questions, comments, and feedback. Thank you for joining us this morning. And today we're talking about interesting talk for our sisters, our mothers, our ladies. And we're going to be talking about menopause. Before we go into menopause, we will briefly introduce us and take us back to menstruation, because it's just the hormonal fluctuations from menopause from menstruation that take us to menopausal symptoms. We generally, when a girl matures, she starts a menstrual period, and this goes as a menstrual cycle for around 28 days. So, and what happens is when the ovum is being released and it's not been fertilized, so it goes around and it comes out as blood, which is termed menstruation. There's a whole lot of hormonal fluctuations that happen within that cycle, but this continues to come every 28 days, every month, and every time for the young girl and the woman and the lady, until when it comes to a time when this stop coming. And one of the signs that shows us as ladies that this is stopping is, it comes to a stage why, we miss our period for 1 or 2 or 3 days, and we know that we're not pregnant when we're getting older. So this is when we feel that menopause or something is happening to our body system. And this is when we're getting to the end of our menstrual phase. So how do we classify menopause? How do we know that we have reached the age of menopause? How do we know that menopause is exactly what is happening within our system? So we're going to go into introduce us and talk about pre-menopause, perimenopause, the menopause phase, and post-menopausal stages. So when we talk about the pre-menopause, this is before the hormonal changes start. And when we talk about the perimenopause, that is when the hormonal fluctuations in our body system start. And that's where when we start having all these symptoms all around our body. And it's usually between that 2 to 5 years, between the ages, standard age between the ages of 45 to 50 years. So it's that where you start having so many fluctuations, so many symptoms, so many issues within the body of the young lady and the woman. So when we want to say, when actually do we say we have menopause, and the stage of menopause itself, this is when the period eventually stops. So when is this? This is exactly if for a year and you have missed your period for a year, then we will say you are now on the stage of menopause. So it's always diagnosed 1 year after the last menstrual period. So it's diagnosed 1 year after the last menstrual period. So if you have not had your period for over a year, then we will classify that, you have reached that stage of menopause. So how do we understand menopause? In the Holy Quran signifies, and it's told us in the Holy Quran in Surah Al-Yasin, Quran 36, verse 68, telling us that it comes to a stage in our life that we have to retrieve back. We get older and we start losing all those little things that make us to be very, very strong and active. And this is what is happening around the age of menopause. So it's a time of change in our life. It's a time that we have to look into so many other things. We have so many symptoms that's affecting what we do in our daily lives. So for some of us that have reached that age of 45 and 50, and we are we're missing our periods, and we're having some symptoms that we don't know exactly what is happening, because traditionally where we come from, some of our parents does not start their menopausal stage until after the age of 60 or 50, olden days. But nowadays, everything has changed, and the average age when we start seeing people starting that's the stage of menopause is between the age of 45 to 50 years, in standard time. So now we're saying this, menopause is not a disease, but it's rather a natural phase of a woman biological cycle. So it's not as if anything's wrong with you. It's not as if you are not well or there's anything that's inadequate with your system. It's just a natural cycle that every woman has to go through in their lifetime. So the period of transition to menopause is known as perimenopause, as I've said before. So what are those changes that we have to see, that we see in our symptoms? That some people, there's so many changes and so many symptoms that most people have seen in their body around the age of 45 to 50. And it can be different from individual to an individual. Some people exhibit 2 or 3 symptoms. Some have just 1 symptom. Some people have more than 5 or 6 symptoms. One of them that's most common and most important is the hot flushes. And all of this happen because of the hormone levels of estrogen and the progesterone decrease in the woman's body during the menopause. So it's because of these 2 hormones fluctuation in the system that is giving us all those symptoms that we see at that particular age. So several biological changes occur as well, and which result in so many of all those symptoms that we see when we reach this age of menopause. So let's go look into hot flushes. Hot flushes are common, very common, and most women experience hot flushes as a sensation of warmth that spreads around the body, and you feel as if you want to take all your clothes off. When everybody is feeling cold, you will be feeling hot. You'll be sweating all over your body, and it varies from one individual to another individual. Another thing that most female experiences at this period of menopause is urinary system fluctuations. So they easily get irritated. Sometimes they have to go to the toilet all of the time. I mean, so several times. Some are susceptible to urinary tract infections. So all of these things are some of the things that you see at the stages of menopause. Another thing that most women see is dryness down below. When they have dryness down below at this age, is another sign of menopausal symptoms, which is due to the changing of the shape of the vaginal walls, as well as decreased production of natural lubricant in down below. So women may feel dryness, and sometimes they have pain when they meet with their husbands. Another thing that is much common that people see at this stage is cardiovascular diseases. And before menopause, we know that there's high estrogen level in the body, and which protect the woman from developing heart disease. But as this goes down and it gets reduced in the body, people start having so many issues with their heart conditions. One of those hormone levels drop due to menopause, and sometimes affect and causes some heart conditions, cardiovascular diseases with some women. Another thing symptoms that we can see with people that people normally come out with is osteoporosis, bone loss. And you can see that our elderly patient, I mean, that age you have, oh, my legs, bending my back. Or sometimes when they sit down for too long, they can't really stand up. They feel that pain, intense pain in their body system. So it's because the level of lubricant in the body is getting low because of the hormonal fluctuations in the body. So if you're having all of the symptoms, it's either you're starting going through the phases of menopause. Then emotional changes. Emotional changes occur due to the low hormone levels as well. And this sometimes cause a lot of issues within the couples, because sometimes when the husband is emotional, or the lady might be very touchy, or the lady might just, anxiety state sometimes setting. So all of these symptoms are the symptoms that we see at this stage when women go to get through the stage of menopause symptoms. So there's a lot of things that we need to look at. Some people do have at this stage. I mean, it's different from one individual to the other. It's different from one person to the other. It's different from one woman to the other. It's different from everybody. So what I see, I get as a woman at this age, it might be different from another woman. And what another woman is seeing, it might be different from what I am seeing. So a woman relationship with menopause can be very, very complicated. At work, they have issues. Sometimes at home with couples, they have issues. Even with their colleagues, sometimes the hormonal situation affects our women in different forms. Statistically, 45% of women have work-related struggle. at this age of the menopausal symptoms. And we're lucky enough that now in every organization, there's policy and document in place to support people that are going through particular stage of menopausal symptoms. And another thing that we have seen is about partners are left feeling helpless because of the emotional fluctuations due to menopausal symptoms. So there are so many things happening within the system, and it's affecting the social life, it's affecting the personal life, it's affecting the financial ability if they can't go to work of people that are going through this particular stage of life. Another thing is getting up. So if we know we have all those symptoms and we know that all of these things are happening in our life, all the symptoms I've mentioned, and how do we go about all of this? There are help out there, and we advise that we try to seek help. If you have any one of the symptoms, which might be different for what, which might be a symptom that is different for what I've highlighted, or you might have had another symptom that is different from this. If you are at this stage of life and you are having some symptoms that you feel is weird, please, and we advise that, speak to your doctor, and you're sure that your period is in and out. You're losing it this month, then, and after 3 months, after 4 months. So all of these things signify that something is happening with your system, and you need to do something about it. As I said earlier on, organizations are putting so many things, especially NHS, so many things in place. At the same time, when you visit your GP, you're going to get help, and there's a lot of things out there for you to read about. But what we're advocating for at the moment is so that this does not affect your emotional life, it doesn't affect more of your physical life, even your work and personal life. We want you, if you have any of the symptoms, to speak to your GP. So we say, talk to your GP. So it is how you feel and not what the blood test says. So we advocate that you talk, say everything the way you feel, so that the GP will be able to know exactly what the problem is, when has they started, or when you need to get help. So how do we address all of those symptoms? When we go into non-medication and non-management option, medication therapeutic management options, we say lifestyle options, exercise, good food, nutrient, okay, and so many things. So what are the things that are available to treat menopause? We have, HRT, which are hormone replacement therapies, and there are also non-hormone replacement therapies medication. And some people, if this is affecting their work, we say that, okay, you change your work. Some people, if this is affecting, maybe you have a lot of flushes, and where you're working is a bit very tight for you, then we just change where you are. Or you're having, sleeplessness at night. So you need to speak to the GP, and they'll support you with support that will allow you to at least have reasonable standard sleep lifestyles. And if you're having continual urinary tract symptoms, when you speak to your GP will be able to support you and help you. And some people that have, if you have emotional issues and it's affecting your love life, your personal life with your spouse, then if you speak to your GP, help will be there. If you speak within your organization, NHS organization has got some a lot of networks that is supporting menopause, and this will be able to help our sisters, our mothers, our women in our community that are going through challenging stages. So once again, do you have any of those symptoms? Do you have mood swings? You just, at this stage, you just change your mood within seconds. Or do you have a persistent headache that is coming in and out, and at the same time, your period is not even regular, and you're between that age of 45 and 50, or you're just tired, there's fatigue all over, you're just tired. With every little thing, you get tired, and you're not sick, it's not so you have any side effect, or you have any issue, or you don't have any underlying condition, or you have persistently hot flushes. You just want to take your clothes off at every instant when everybody is feeling cold. Or you have palpitations, every single palpitation within you. And you're at this age you're at the age between 45 and 50, where you have missed your period 1 or 2, or 1 month, 2 months, 3 months. We advise that you are going through menopausal stages, and we advise that you speak to your GP. Don't do this alone. because you are not alone. So try to speak to your GP and you'll be able to get some help. So if you know of anybody or family that is going through all of this, that is better, please advise them that there's help out there to support people to be able to go back normal to life. At the same time, they go through this, and at the same time, they'll be able to get help that will support them. So while women go through all of those things, 3 out of 4 experience all of those symptoms, and they say it out. And 1 in 4 have serious symptoms, and so don't even say it to anybody. They try to take it in and continue to do it address it themselves. So what we say is try as much as possible to seek help if you think that you are going through all of the symptoms that we're talking about. Research also shows that the majority of women are unwillingly to discuss menopause-related health issues with their line managers or ask support when needed. So this is the point we are now. So we have to open up, we have to speak out, we have to talk. So if we're going through any of those symptoms, please speak to the nearest person to you, your GP, your employer, or your friend that you know can help. Or go online and you can see a lot of help are out there, a lot of networks are out there that can support you at this particular stage of life. Because it's not a disease, it's just a natural process that every woman go through. So what can you do to help other people? If you are aware, as we have had this lecture this morning and this talk, so what can you do to help other people? So support, raise this awareness. That is what we're doing today. We're using this opportunity at Ramadan Radio to raise awareness within our women, our elderly women, our sisters that are in this particular age of 45 and 50, and they're going through the stages of period today, period next month, missing their periods, and having all of those symptoms I've talked about, to raise this awareness, to speak to their GP and seek help. And if you have circles, go there, have circles, talk, support, and encourage people, signpost people where help are. And what else can you do to support others? If you are at work and you're working, you're a manager, you're within an organization, try to put something in place to support people at this point. Just put something like put a menopause policy. When we know that, okay, a particular worker is not well, is said she has hot flushes or she has some menopausal symptoms, how do you help that particular person? So put a policy or statement in place within your MOCs, within your organization, within your association to support people, sisters at this particular age group that are going through menopause. So whereby, if personally you wanted to help people, try to make reasonable adjustment. If someone is not well and at work and miss somewhere where they can just open the window or they can just open the door or they just need that particular little support, please be ready to make adjustment. Then there are some coping strategies in place. Try to put coping strategies in place in your association work or wherever you want to support this particular area of sisters, because what we see is that because it's a natural process, either you like it or not, we have people that we continue year in, year out to go into this particular phase and come out. And remember, I say this will last, this continue until a particular age where we can, until when the patient, the person, a year doesn't have all of those symptoms for a year, then we know that it's post-menopausal stage. So it will continue for quite a while. So, and if you can imagine people having all of those symptoms and they continue to go to work and they continue to meet in circles and they continue to do every daily activities that people need to do. And people are feeling restlessness or they're tired or they're having hot flushes, and you expect them to do the same thing that every normal person do, and that will not be right for any one of us to see. So I will advise, and this is that we try as much as possible to support ourselves at work, at home, in our associations. One of the other things that we can do is funds. Well, if we are at work, try to take a little fund to work or keep extra fund in your house, in your little household or somewhere that will support you, that will cool the environment up. And also flexible working. If you're working full time and you know that you're always tired or you feel sleepy all of the time, so try to speak to your manager and see if you can ask for flexible working. and clothing. If you're in NHS or you work in an area where you are supplied with uniform, and you know this particular uniform is giving you more than necessary. So sometimes it's the material that they use to sew the clothes that is causing the problem, and it adds on to the natural hot flushes you have. Please speak to your manager and see if you can get another uniform that will be cool enough to support this stage of your menopausal stage. Then we advise as much as possible to stay healthy. Because it's an hormonal fluctuation, so we advise that people stay healthy, you do exercise, you eat good food, you eat and things that will support the nutrient in the body system. So eat what is right. When we say eat what is right, we say by eating a calcium-rich diet, you can prevent or slow down the development of osteoporosis in the system. So dairy products like milk, beans, broccoli, and calcium-enriched foods are recommended. So this will support you, especially when those people that have osteoporosis. So may Allah continue to make it easy for all of us. Then how do you protect your heart? It is crucial that you eat healthy, low-fat food. Low-fat food. So when we're eating, try to reduce the fat in your body, low cholesterol and low sugar food, low sugary food. So low fat, low cholesterol, low sugary food. This will help to decrease your risk of heart diseases at this particular stage of your life. So if you're experiencing all of those symptoms and you are between the age of 45 and 50 and you've been missing your period, and you think that this is what is happening to you, try as much as possible to support yourself by eating what is right, protecting your heart, and avoid smoking. So if you're one of the people that smoke, it's one of the things that you have to stop, and you have to try to reduce smoking so that it doesn't increase the risk of you heart disease, because smoking has been found to be a risk factor in heart diseases and lung cancer. So, and osteoporosis as well. So if you're smoking, this is not good for you at this particular stage where you are experiencing menopause. So exercise regularly. We know because of COVID-19, we've been indoors and some of us have not had the opportunity to exercise. So it's important that now that at least we have the opportunity to go into gardens to try to do some basic exercise that will support us to keep us healthy. Physical activities decreases the risk of heart diseases and can counter the process of bone loss. So not only will exercise promote your physical health, but it will also promote your mental well-being. So exercise is very, very important. It's crucial to our day-to-day activities, and it will help us to live a longer life. And as much as possible, support our body system if we're going through the menopausal stage. So please try to do these 4 things and all other things that will support you at this particular stage. We say eat right, look at what you eat, reduce fat, reduce cholesterol, protect your heart. Okay, protect your heart, then avoid smoking, do exercise. May Allah continue to make it easy for all of us. So we generally say that you don't suffer in silence. Don't think that, you just continue like that, or you just say, okay, maybe because the natural process, you try to struggle and you're not even, when there's help, you're not asking for help. And you try to not even speak to anyone. You don't speak to your doctor, or you don't speak to your healthcare professional. So, all of those things are the things that we need to try to stop. When you are going through anything that you need support, please seek help, because there's so many help out there. And this particular stage is a natural stage. It's not a disease stage. It's not something that you have to run away from. When you get to that stage, it's just natural for women to go through the stages of menopause. So when you go through the stages, please seek help, and there's so many help out there for you. Your GP will be able to signpost you. There's a lot of groups, network groups that will help you. There's a lot of resources out there for professionals. For every professionals, wherever you are, there's a lot of help there to support you at this particular stage of menopause. So what I'm advocating now is for our brothers in the mosques, our sisters in mosques, to try to put a policy in place for people going through menopausal symptoms. So inshallah, and this will be able to, this will support our sisters as well. So that they know exactly it is not that anything else is wrong with them, or there's a particular disease hiding somewhere else. At this particular stage between that age of 45 and 50, where you're missing your period, definitely the hormonal level is going down and the body is going to respond. And as I said earlier on, there's so many treatment options that are out there for us. So medication treatment, when we talk about medication treatment for menopause, we have the hormone replacement therapy. So this has been a subject of controversies. I mean, it has worked for some people it doesn't work for them. There's some of them comes in capsules, some comes in patches, depending on whichever one that fits your body system and your cycle or your way of life. So whichever one, when you speak to your GP or your healthcare professional, they'll be able to speak with you and you can arrange together on the best option for you. So it's either you want to take the tablet or you want to use the tablet. So there's also some alternative medical therapies which are becoming increasingly popular for the treatment of symptoms of menopause. There are also some herbal preparations, such as so many things in there that it's not licensed to us as pharmacists, but there's so many other things that people have used and it has worked. But before you take them, or if you're on any other medication, please speak to your GP so that we don't have side effects or drug interactions. So may Allah make it easy for all of us. So if you are experiencing all of the symptoms of menopause, as we say, hot flushes, night sweat, irregular periods, loss of libido, vaginal dryness, mood swings, fatigue, hair loss or thinning, sleep disorders, memory loss, difficulty in concentrating, disturbing memory loss, dizziness, weight gain, incontinence, bloating, increase in allergies, changes in fingernails, weakening. We talked about osteoporosis as well. So changing in body odor as well. Some people have another weird smell when they are going through at this particular stage. Some people smell differently. So all of these things, when you start seeing things that are not normal as you've been before, and you know that you're between that age of 45 and 50, so think about, whoa, maybe this is what we're talking about. It might be a sign of menopause that you're going through. Irregular heartbeat, we talked about cardiovascular effect because of the reduction in the hormone system and so many things that's happening in your system. So all of these things, if they come together, please speak to your GP. Then some people are stressed, some people are depressed because of all of those symptoms coming together. And when you're depressed, you lose that vigor, you lose that strength, you lose the energy. And once you have depressed, productivity is generally low. So if you feel depressed and you're in this particular age group of 45 to 50, and you have missed 1 or 2 months of your period, please speak to your doctor. And anxiety as well. Anxiety comes in through. Some people experience it, and people show their own stage of menopause by having anxiety. So anxiety is one of those things that we need to work on as well. So if you notice this within your colleague at work or within your colleague in the mosque, within your sister's circle, please try as much as possible to signpost them to help to their GP or the help that's available within your workplace, or if it's available within your mosque and work circle as well. The irritability, they easily get irritated with little things. So one of that major aspect of signs and symptoms, if you see anybody having it, or you personally as a sister or a lady or woman, you're irritated at everything, and you get, so all of those things, please speak to your GP, seek help. There's help out there and you're not alone. Then feeling breast pain. So people have this breast because of the fluctuation in hormone level, and we know as women, our body is linked to so many things. So if you have consistent, persistent, you're not pregnant, it's not as you are trying to get pregnant, and you have consistently breast pain with some of 1 or 2 or more of the symptoms, and you are aged between 45 and 50, and you have lost, you have missed your period once or twice within a year, please speak to your doctor. You might be going through menopause. and you may need help. Then headaches. Headache is most common with people. Persistent headache coming in and out, and it's not even, sometimes they take painkillers, is not going away. So all of this at this particular age, with one or two of the symptoms, and you have missed your period, I mean, occasionally once or twice within a couple of months, within a year, and you have all of those symptoms, please seek help. You're not alone. Speak to your GP and your healthcare professionals. Then aching joints and muscle problems. At the onset of this talk, we mentioned osteoporosis. So this will lead to aching joint and muscle problems. So you're not alone. It's the act of the estrogen and progesterone reduction in the system. So you can visit your GP and they will support you with the right treatment, with the right advice, so that you can live a normal life again. So burning tongue. This is being reported by some women. I mean, they just have burning tongue. Their tongue is just burning occasionally, with some of one or two symptoms. I mean, maybe with hot flushes, fatigue, general headaches. So one or two symptoms. Please speak to your doctor, and you'll be able to get help. So electric shock sensation. You just sit down and your body will come, just something like electric shock in your system. And this continue for a while. So all of these are the symptoms of, imbalances with the hormone in your system. So something's wrong somewhere. Something is not really right somewhere. So please, if you have all of those symptoms, you have that electric shock occasionally come into your system, or you have hot flushes, or general body odor has changed, you have headaches, you are tired, you are stressed. All of those things come in. Please speak to your doctor or seek up. Gum problems. Gum problems is common again, and people have pain within their teeth. This again is hormonal fluctuations sometimes, which is related to to menopause. And please seek help. Your doctor is there, your GP is there, your healthcare professional is there, and NHS, we have a lot of network of support for menopausal stages. So speak to someone, and inshallah, someone will be there at the other end to help. Then we have digestive problems. Some sisters, some women has experiences continuous digestive problem, going through irritable bowel syndromes, constipation. So it's better we go in so that we can distinguish that this is not something else, it's menopause. So it's better when you have all those things coming together, and you're at this particular age, between the ages 45 and 50, and you haven't had your period for the, your period has been coming on and off within the last 1 year, please speak to your doctor or your GP or your healthcare professional, and they'll be able to provide help for you. Then increased tension in the muscles. We talk about electric shock just a while ago. All of these are part of the things that some people experience as symptoms that is signifying that stage of menopause for us. So may Allah make it easy for all of us. And itching skin, cold skin. Your skin start itching all over the place. We've got some women that experience shows the symptoms of menopause with this particular way. They have itchy all over their body, they have allergies all over their body, and they just continue to itch. So to some people, they just exhibit these symptoms as a sign of that stage of their menopausal symptoms. So if you fall into this category, please try as much as possible to speak to your doctor. Just give me 1 minute, please. I'm sorry. So please, if you're experiencing all of those things at the point of your life, please speak to your doctor, and you'll be able to have someone to help you and take you through. And the last thing that we will talk about is tinglings at the last, at the finger peak, at your finger peak. People have a lot of, having some tingling sensation at the fingertips. Some people complain of that as well, apart from everything that we've talked about today. So if you have any of those, and you're experiencing loss of period within the first, second, or third month, and within a year, please speak to your doctor. So these are the things that we need to look into at this stage of our life. And as I said earlier on, this is not a disease. This is just something that every woman needs to go through. So if you're going through any of those things I've mentioned, please try as much as possible to speak to your GP, your doctor, your healthcare professional, someone in your place of work. You're not alone. Help is there. Help is there. May Allah continue to make it easy for all of us. And remember that as Muslims, we have to continue to seek for knowledge. We should not live in isolation. We should not live as if we can do things. When we need help, please ask for help. May Allah continue to make it easy for all of us. May Allah continue to be with us all. Amen. Thank you very much for joining me this morning. And if there's any other questions, you can always send feedback, talk into our WhatsApp messages on the phone I have said earlier on. Subhanaka Allahumma wa bihamdik. Ashhadu an la ilaha illa anta wa nastaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh, sisters. Thank you for listening.